The ACOSOG Z9001 trial, transforming gastrointestinal stromal tumor care. A comprehensive review on the Everything Surgery podcast. Welcome to the Everything Surgery podcast, where we dissect the extraordinary in surgical science. Today, we are delving into one of the most influential clinical trials in the management of gastrointestinal stromal tumors, the ACOSOG Z9001 trial. The ACOSOG Z9001 trial was a landmark study that completely changed the way we approach the treatment of gastrointestinal stromal tumors. This randomized, double-blind, placebo-controlled Phase 3 investigation established Imatinib as the first effective adjuvant therapy for patients following surgical removal of their tumors. Key details of the ACOSOG Z9001 trial. The trial enrolled 713 patients who had gastrointestinal stromal tumors that tested positive for the KIT protein and measured at least 3 centimeters. Each participant had undergone complete surgical removal of their tumor. The intervention compared 1 year of daily Imatinib at a dose of 400 mg to a matching placebo. The primary outcome the researchers focused on was recurrence-free survival, which refers to the length of time patients remain free from tumor recurrence after treatment. Major findings published in The Lancet, 2009. One of the most striking results was the significant improvement in recurrence-free survival among those who received Imatinib. At 1 year, patients in the Imatinib group had a dramatically higher rate of recurrence-free survival, 98% compared to 83% in the placebo group. At a median follow-up of just under 20 months, Imatinib reduced the risk of recurrence or death by 65% compared to placebo. Initially, the study did not show a significant improvement in overall survival. This was likely due to the trial design, which allowed patients in the placebo group to switch to Imatinib if their tumor recurred, making it difficult to detect a survival difference between the two groups. In terms of safety, Imatinib was generally well tolerated. Most patients experienced manageable side effects, such as fluid retention, fatigue, and nausea, which did not outweigh the benefits of therapy. Long-term outcomes and clinical significance. Subsequent analyses, with a median follow-up of over 9 years, confirmed the enduring benefit of Imatinib in preventing recurrence. For patients at higher risk, a small but statistically significant improvement in overall survival was also observed. The trial demonstrated that 1 year of adjuvant Imatinib is effective, but later studies showed that extending therapy to 3 years provides even greater benefit for those at highest risk. Impact on clinical practice. The ACOSOG Z9001 trial transformed the standard of care for patients with resected, high-risk gastrointestinal stromal tumors. It proved the concept of adjuvant targeted therapy in oncology and set the model for similar approaches in other diseases. As a direct result, Imatinib received approval from the United States Food and Drug Administration for adjuvant treatment of gastrointestinal stromal tumors in 2008. In summary, the ACOSOG Z9001 trial demonstrated that 1 year of adjuvant Imatinib significantly delays tumor recurrence following surgery for KIT-positive gastrointestinal stromal tumors, establishing the first effective adjuvant therapy for this condition. Thank you for joining us today. If you appreciate our deep dives into surgical breakthroughs, please like, share, and subscribe to the Everything Surgery podcast. We look forward to bringing you more extraordinary stories from the world of surgery.